It involves three processes. One is glomerular filtration, and another process is tubular reabsorption, and the third process is secretion. Glomerular secretion. It means the blood, the plasma, it is having several unwanted products, excretory products, waste products. Okay? That has to be eliminated. Moreover, beside these unwanted products, these products are wanted but they are in excess. So we have to eliminate those things, and it will be done by the kidney. We will eliminate all these waste products by the three different processes as I mentioned. Okay? So blood will first enter into the kidney, then it will be passing through the glomerulus. So in the glomerulus, what is there? Capillary, glomerular capillaries. These capillaries are actually filter. Okay, filtration membrane. Through this, some substances, something will be allowed to pass through, some will not be. Okay, so this is called filtration. What is filtration? Normally, what do you mean by filtration? What do you mean by filtration? Separation of, not waste. Separation of solutes from liquid or gas by means of a sieve, filter, across the filter. Okay, so that is the filtration. And after filtration that we get what? Filtrate. We call this glomerular filtration ultrafiltration. So what is the difference? Same. Only thing, here pressure will be required. Some force will be required. Okay? So we'll discuss about this. What are these forces? Stalling forces. Here also, stalling forces will be involved. Okay? So they will create one force. All this surface, some forces are okay. They will allow filtration, and some pressure will not allow filtration. Rather, they will oppose filtration. So ultimately, there will be balance. And after this balance is done, what we'll see, one filtration pressure will be created, that is called effective filtration pressure. And because of this pressure, filtration will be there. Okay. So the glomerular filtration is the first phase of urine formation. And from this part, today's part, these are the questions you may be expecting. What is this? Renal blood flow is auto-regulated. This is an explanatory question. Okay? Define GFR, glomerular filtration rate. What are the factors affecting GFR? We will discuss it. And glomerular filtration rate. Okay, you have to know it in a better manner. What is the filtration? What is its characteristics? How it determines the glomerular filtration rate. Means it can affect glomerular filtration rate. And stalling forces, regulation forces I dropped one word, stalling forces in regulation net glomerular filtration pressure. In regulation of net glomerular filtration pressure. So these will be discussed today. So as I said, urine formation requires or done through three processes. glomerular filtration, tubular reabsorption and tubular secretion. So, blood is entering here, enter into the glomerulus. So here filtration will be made. Now this filtrate will be passing through this tubule. This is what? Renal tubule. So from this tubule, some solutes, water, they will be absorbed into the blood. And because these are important for the body, I have filtered everything, almost everything. Okay, so out of this, some are very important for me. So that part I will reabsorb. And some part I will secrete it. Some part is secreted through this filtrate, some part is secreted from this, not filtered, but directly from the blood will be secreted here. So this is glomerular secretion. Okay, then urine formation, there will be formation of urine. Okay, what is filtration? What is the definition of filtration? Glomerular filtration is the initial step of urine formation where blood is filtered across a specialized membrane in glomerulus of nephrons of kidneys. This membrane called the glomerular filtration membrane, it has tiny slits, tiny pores through which the solid and liquid passes through. Okay, like water, glucose, electrolytes, almost all the electrolytes pass through it. While larger molecules like blood cells, okay, and plasma proteins. Remember, these will not be filtered. Blood cells, if blood cells are filtered, then it is a pathological condition and this is called hematuria, presence of blood cells in urine. That it will indicate that something wrong in the kidney, in the glomerulus, because blood cells are coming out, that too in the glomerular filtration bed. And if you get the protein in urine, that is also abnormal condition. This may be nephritis and maybe nephrotic syndrome. We will discuss it about the different renal diseases. Okay. So the filter, that is after filtration, the fluid we get, that is called glomerular filtrate. And what is the difference between glomerular filtrate and plasma? Difference between only plasma proteins are absent. Only plasma proteins are absent in glomerular filtrate. Okay. Otherwise, these are same as plasma. Other constituents are almost same. Blood cells will not be filtered always. So, this filtration bed, they will prevent filtration of blood cells and plasma proteins. Is that okay? I already explained why glomerular filtrate is called ultrafiltrate. Filtration is done again under a force, under a pressure. That's why it is called ultrafiltrate. Fine. Even the finest solutes are also filtered. This filtration through the filtering membrane has two important factors. One is filtration coefficient. I will explain it later. How much glomerular filtrate will be formed? What will be the rate? It will be determined by the KF, filtration factor of kidney, and filtration coefficient of kidney, and the pressure gradient created by Starling process. Okay, I will explain it. Now the glomerular filtration membrane. 3 layers. In the glomerular filtration membrane, you will get 3 layers. One is, since it is the capillary, so capillaries are having a wall. What are these? These are the cellular wall. What is this cells? Endothelial cells. And these endothelial cells are lined on a basement membrane. So there is basement membrane and endothelial cells. endothelial cells, and this is the basement membrane. And you see, the endothelial cells are fenestrated. Means, these cells, endothelial cells, are separated by a slit, by a pore. Okay? These pores are called fenestra. These are fenestra. These pores are called fenestra. Okay, so this is the endothelial lining, and this is the basement membrane. Okay, so this is the basement membrane. Okay. Now another layer is there. Bowman capsule. Bowman capsule. These cells are parietal layer. They form the parietal layer. They form the parietal layer. And these cells form visceral layer. These cells of Bowman capsule forms visceral layer. Now, here are the capillaries. So here I will get this visceral layer, these are cells of the visceral layer. These cells of the visceral layer is termed as podocytes. What are the cells? Podocyte. So here you will find podocytes. So these podocytes are lying on another basement layer. This is the podocyte. You can think of this my wrist as podocyte, and these are the food process. These are the food processes. So these podocytes are also having food processes. Now these food processes are having slits, gap. These slits are called slit pore. And these food processes are called pedicles. So in between the pedicles, there is a slit. These are the slit processes. Okay. Now let's see a diagram. The capillary endothelium, the fenestra. What is the gap? How much is the gap? 70 to 90 nanometer. Okay? And the basement, there are how many layers? 2 layers of basement. And this basement layer is made of 2 types of chemical substances. 2 types of compounds. What are these? One is collagen, another proteoglycan. And these proteoglycans are negatively charged. And they are also having tiny pores. In their mesh, in between, there are some tiny pores. And these tiny pores are having the size of the pore 2 to 8 nanometer. Okay? And the food processes, here the slit pores. What is the size of the slit pores? 4 to 11 nanometer. So these are the pores through which the plasma contents. Actually filtration is done for plasma. So they are to pass through this. Some bigger size particles, plasma proteins, they are not able to pass through this. But albumin can, because its size is less than this, less than all of this. Then albumin should come out. But no, bulk albumin is not filtered. Why? All the albumins, all the plasma proteins, the molecules are negatively charged. They are negatively charged. Here, the cells as well as the proteoglycan molecules, they are negatively charged. So negatively charged, they repel. So they will not be able to enter. That's why albumin cannot. Though the pore size is big, bigger than albumin, it is not allowed to pass in because of its negative charge in it. Okay. Have a look on this. What are these? Podocytes, food processes, and in between filtration slit pore, and basement membrane, and the collagens and proteoglycans are having slits, and these are less than 6 nanometer in diameter, and these are the endothelial cells. See, fenestra, this is the fenestra, big, but less than blood cells. Okay? Endothelial cells, endothelial cell lining. So these are the fenestra. Outside this, there is basement membrane made of protein and not protein, collagen and proteoglycan. Now, fenestra. What is function? It prevents filtration of blood cells and allows all components of blood plasma to pass through, except the first pore, that is endothelial pore. This will block the entry of blood cells. All other things will be allowed to pass. Okay, now you go. Let's see what happens next. In the next gate, it is the basement membrane, basal lamina. It prevents filtration of larger proteins. And the slit pores, they prevent filtration of medium-sized proteins. Okay? So these are the functions of various slits, pores present in the membrane. And one of the important things you must remember, what is this? This capillary, length of the capillary, surface area of the capillary, it may be lowered. It may be lowered. If I lower the surface area, shorten the capillary, filtration area will be less amount of filtration will be there, isn't it? Okay, now who will do it? We know there are two types of mesangial cells. Two types of mesangial cells. One is extraglomerular. We have seen it in JJ apparatus. Another is glomerular mesangial cells. So these mesangial cells are present in between the capillaries. And these mesangial cells, they can contract. When they will be contracting, the capillaries will also be shortening. As a result, what will happen? There will be shortening of surface area, filtration surface area. Is that clear? Okay? Fine. Question. What is filtration rate? You may face this question. What is filtration rate? Glomerular filtration rate is defined, GFR. It is defined as volume of filtrate formed each minute by both kidneys, not by a single nephron, not by a single kidney, by both the kidneys together. Okay? So per minute, how much filtrate is formed? That is GFR. And what is its normal volume? 120 to 125 milliliter per minute or 180 liter per day. Let us explain how it comes to be 180 liter per day. This is our circulatory system. Blood is circulating. Every minute it is circulating. How much blood is circulating in each minute? How much blood is circulating in each minute? Very good, excellent. 5 liters per minute, isn't it? So, how much blood is there? Every minute, 5 liters per minute is circulating. And out where this blood is going? Different organs. So, kidney will get the share, no? Kidney has to get its share. How much? Its demand is very high. Its demand is very high. 20%. 20% only the kidneys get 20% of the total cardiac output. How much then? How many liters it will be? 20% of 5 liter? 20% of 5 liter? 1 liter. All others are very poor in mathematics. So out of this 5 liter, 20% of 5 liter will enter into kidneys. Will enter into kidneys. Okay, how much it is? 1 liter. Blood. Out of 1 liter of blood, how much is plasma? Hey, how much is plasma? There are in blood body, there are cells and plasma. How much will be the plasma? Okay. What is this called? Ratio of this plasma and hematocrit. What is this called? What is the value? 40 is the cell, 50 or 60 is the plasma. So out of 1 liter, how much will be the plasma? 600, isn't it? 100 ml has 60 ml. 1000 ml will have 600 ml. So, (600 ml of plasma entered into all the glomerulus, not in a single glomerulus. Altogether, how much plasma entered? In all the glomerulus total? 600 in 1 minute. 600 ml of plasma, because this will be filtered, cell will not be filtered. Okay. Now, how much plasma will be filtered? How much? All? No, part of it. Part of it. How much? 20%. 20% of 1 liter. How much? So, not 1 liter. (600 ml plasma), 20% of it is filtered. 20% of 600 ml, 120 ml. 120 ml. In 1 minute, all the kidney nephrons, they will produce 120 ml per minute. What it will? This is the filtrate. In 1 minute. So this is the glomerular filtration rate. Normal rate is 120 to 130 ml per minute. And average value is 125 ml. मान लो, it is 125 ml. Okay. Now 125 ml per minute filtrate is formed. How much filtrate is formed? In 1 minute, By both the kidneys, 125 ml per minute. In 1 hour, how much? Multiply it by 60. And in 1 day, and it is 180 liter. And it is 180 liter per day. 180 liter of glomerular filtrate is produced per day. And you know, from this, how much urine we get per day? Only 1%. And 99% is reabsorbed. Out of this 125 ml, what happens? 99% is absorbed and only 1% is eliminated as urine. Okay? And what is the per day how much? 180 liter of glomerular filtrate produced per day. So what is the 1% of this? 1.8? Hurry, 1.8. 1.8 liter. So this is the volume of urine we produce per day. So 99% of the filtrate we absorb, 1% we eliminate as urine. And all this amount, this 1.8 liters, 1.5 liters of urine will contain all the excretory substances. Okay? We produce nearly every day we produce 600 milliosmol waste products. 600, and this can be accommodated in minimum 500 ml. When less than 500 ml is urine is excreted, somebody is eliminating only in whole day less than 500. Good, my goodness, renal problem might be. So it is a threatening condition. Okay, so it should not be, then it is to analyze, what is this, what happens to his renal function. So you are doctor, so you are going to doctor, you will be, first what is the urine volume, and it should be more than 500. Otherwise you call it more than oliguria. When it is more, very much more excessive urine formation, it is called polyuria. Okay, so both are not good. GFR is very important for clinical purposes. From the GFR, we can use this GFR and creatinine value to estimate the degree of damage of the kidney in different diseases. Sometimes we say that 100% kidney is damaged. 25%, 40% kidneys, we calculate it from these only. Okay, we require this GFR value and creatinine value. We can estimate. So what is the status of the kidney? Actually, GFR signifies the status of the kidney. How well our kidney is. This is already I explained. Filtration fraction out of 600 ml, how much we got? 125 ml of filtrate we got. So what, the GFR 125 divided by plasma, amount of plasma. What is the amount? 600. So divide it, the factor we get, that is the filtration fraction. If the filtration fraction is more, that means more filtrate is producing. If the filtration fraction is less filtrate we are getting. Now, we have seen the glomerular capillary membrane, we have seen, already discussed there are different layers, and here we have seen that the membrane has got two important things. One is permeability to solutes. Its permeability to solutes. It determines this membrane determines who are to pass through, who are not. Who will not be allowed to pass through, who will be allowed to pass through. So this is one of the, and it is determined by the pore size, isn't it? By the negative charges, isn't it? So this is one of the factor. Another factor is length, means area of filtration. So if you multiply both the factors, then we get the Kf value. So what is Kf value then? It is the product of permeability and area, surface area of the membrane. We know surface area of membrane can be increased, decreased by mesangial cell contraction. So that is also an important factor. Okay? Now, what is Kf? What is Kf? Capillary permeability into size of the capillary bed. That is, size of the capillary bed means area of the capillary bed, area of filtration membrane. And GFR, you want to GFR, then you have to know the value of Kf. You have to know the value of Kf. And what are the value of Kf is one of the factor. Another factor is, two factor, another factor is affecting filtration pressure. So, GFR, what is GFR? GFR equals to Kf into net filtration pressure. So now, sir, what is net filtration pressure? This net filtration pressure, I will now explain. This net filtration pressure is created by Stalling process. Now there are three Stalling forces are operating here. What are these Stalling forces? This is the cavity, lumen of the Bowman capsule, and this is in continuation with proximal convoluted tube. Through this, filtrate will be passing. Through this filtrate, this is the glomerulus, from where filtration will be there, and this filtrate will be passing through this to the renal tubules. Okay, now see. Afferent arteriole, and this is efferent arteriole. Stalling forces. Blood is passing, isn't it? Because of a pressure. Because of a pressure, and this pressure is called hydrostatic pressure. And this pressure is called hydrostatic pressure. So here we are having glomerular hydrostatic pressure. It is a pipe through which a fluid is passing. If there is any pore, what will be there? The fluid will be coming out because of this hydrostatic pressure. So this pressure actually likes filtration, favors filtration. Okay, so these will be favoring this glomerular hydrostatic pressure will always favoring filtration process. Outward force, bharja. These are the outward force. Okay, but this blood is also having another thing, the proteins. And we know the proteins are also exerting another pressure. What is this? What is this pressure? Plasma protein exerts osmotic pressure or oncotic pressure. Okay. So oncotic pressure or osmotic pressure created by them. What are these? Capillary oncotic pressure or capillary osmotic pressure. Okay? Do they favor or they prevent osmosis? What do you think? Colloidal osmotic pressure. They always want fluid. So they don't allow fluid to pass through, to go away. They want always, they should want to remain together with water. So it prevents filtration of fluid. Okay, so this is the opposing force. And what is its value? Let us think about. How much? What is the osmotic pressure, plasma osmotic pressure? Normal osmotic pressure? Okay, say 30 or 35. Say 30 or 35. 35. Okay. And osmotic and hydrostatic pressure is 60. How much? 60. Okay. So this one is 60 mmHg. This one 60 mmHg. It favors filtration and it doesn't favor infiltration. It tries to pull water from here to here, and it tries to push water into the lumen. So they are opposing. Who is more powerful? This is 30. Okay? And in the Bowman capsule, here already some fluid is there. Okay? You want to go out. This is the passage. Nobody is there. You can easily go out. Is already some students are there. Then what will happen? If you want to go, you have to push them, then you can go. So they will oppose your exit. Isn't it? So there is another pressure within this fluid. The fluid present here, they will oppose this. And this fluid pressure is called Bowman capsule hydrostatic pressure. Bowman capsule hydrostatic pressure. And what is the value? It may be 15, it may be 18. Okay. Let us come to one example. 18, this is the osmotic pressure, and this is the Bowman capsule. It is 18 millimeter of Hg. And how much is this? Capillary 32. This is 32. And this one is 60. Yes. Now you see. You can consider the pressure that favors filtration, take it as positive, and they to oppose filtration, you can take it as negative. Okay, then algebraic sum. So how much it will be? 10 millimeter of mercury. And this 10 millimeter mercury pressure is the effective filtration pressure. This effective filtration pressure, 10 millimeter mercury, into Kf, then we get GFR. Okay, then we get GFR. Now, if I know GFR, if I know net filtration pressure, can you determine, net filtration pressure, that is, which is 10, and you know the GFR, which is 180 ml per minute, then you can determine the value of Kf, isn't it? The Kf, then in that case, what is the value of Kf? GFR by net filtration pressure. Okay, then we'll get the value of Kf. And this value of Kf is important. Higher the value of Kf, obviously, higher will be the GFR. Higher will be the GFR. So that's why when we'll be analyzing the factors, one of the factors will be Kf. Isn't it? One of the factors will be Kf. Now we know Kf is the product of permeability and surface area. So if any one of these is increased, then Kf will be increased, then GFR will be increased. That means both the factors permeability and surface area are also directly related to GFR. We will discuss it or mention it in what are the factors affecting GFR. Now see, this is what in every book you will get this. What is this? Some particles are having positively charged ion and some particles are having negatively charged ion, and they are having some size. So let us take this example. One negatively charged particle is having size of 34, and you see its relative filtration is 0. This is negatively charged. If the size is 34 Dalton or angstrom, it will not be filtered. And see, this is positively charged. This is positively charged, and its filtration ability more than about 0.5 means to some extent that can be filtered. Understood? Increased glomerular capillary filtration coefficient Kf, if it is increased, GFR will be increased. Okay. Second point, increased Bowman capsule hydrostatic pressure. Okay. Now I have to see one thing. Somebody is having kidney stone. Okay. It is having kidney stone, and the stone came out of kidney, enter into the ureter and coming into the bladder, not entering into the bladder, it has blocked the vesico-ureteric junction, the junction where ureter enters into the bladder. That's why here it is blocked. The lumen is blocked by the stone. Now what will happen to the GFR? Urine will not be able to enter into the bladder. So urine will be blocked in the ureter, into the pelvis, into the major calyces, into the minor calyces, and no urine can be entered from the collecting tubule. No, in the collecting tubule, where they are coming? Through, ultimately coming from Bowman capsule, proximal convolutive, loop Henle, they will not be moving. As a result, in the Bowman capsule, fluid pressure will be increased, fluid hydrostatic pressure will be increased. Now what will happen? GFR will be increased or reduced. Bowman capsule pressure it inhibits filtration. It is the opposing pressure. So as a result, what will happen? GFR will fall. There will be less urine formation, isn't it? So when there will be hydronephrosis, means this is one thing. And when there is infection of the subcapsular region is inflamed. Subcapsular region means kidney is having the capsule. If subcapsular region is inflamed, then also GFR is also reduced. Already explained. Here another case. Pressure is, instead of 60, pressure is hydrostatic pressure is 55 instead of 60, and instead of 18 it is 15, instead of 32 it is 30. Now what is that? Saying 10 millimeter of mercury effective filtration pressure. Okay. So in some book, this example is given. In some book, like a guidance, the earlier example is given. So you understood this? Measurement of GFR, today I will not explain it. in the last but one class, in that class it will be explained. Renal function test. And within renal function test, clearance test is one of the measurements. How it is measured, what is the clinical value, in that class I will explain. Clinical relevance, GFR, what is the usefulness in clinical medicine? First, GFR is a renal efficiency marker. How efficient your kidney is. Decrease GFR, not good, because urine output will be less. Okay? So impaired renal, in case of impaired renal function, GFR is reduced. And when the GFR is below 60 ml, normally it is 120, 125 ml per minute. If it comes down to below 60 ml per minute and it is maintained for this condition is maintained for last 3 months, then the person is definitely suffering from CKD, means chronic kidney disease, chronic renal disease, means his glomerulus nephrons are fibrosed. They are fibrosed. The patient will also be suffering from anemia. Can anybody tell why? Erythropoietin secreting cells, they will also be transformed into, they are fibroblasts. Fibroblasts, they can change anytime. They are like, any other, they can change to any type of cells. Okay? Not any type, they are changed. And this is important for staging CKD. At what stage, how much damage has been done. So this can be, and drug dosing. Okay, so if you have a patient came to you with very low GFR, then what to do? So you will give medicine. If he is improving, okay, you will be reducing the dose. And if it is it is instead decreasing, then you have to adjust the dose. So that purpose it is also needed. Now these are the factors. Write down all these 13 factors. See, all are acquainted. Renal blood flow. More renal blood flow, means more hydrostatic pressure. More renal blood flow means more hydrostatic pressure. More hydrostatic pressure means more GFR. So it will increase GFR, directly proportional. This tuboglomerular feedback, this kidney maintains auto-regulation. Means blood flow, kidney always, whatever the blood pressure is there in the circulation, I will maintain my circulation. Whatever in between 80 to 180 millimeter mercury pressure, within this range, outside fluctuation is there. So the kidney will, even though there is much fluctuation, kidney will maintain renal blood flow constant. This is its capacity. So how it is done? By two processes. One is by reflex. One of the reflex processes there, myogenic theory. One is myogenic theory. Another is tubular feedback mechanism. So by these two mechanisms, kidney maintains, auto-regulates its blood supply. Even there is fluctuation in blood pressure outside, in the systemic circulation. Glomerular capillary hydrostatic pressure, this will increase GFR. Plasma colloidal osmotic pressure, this will decrease. Bowman capsule, we have already told, it decreases GFR. Constriction of afferent arteriole. Constriction of afferent arteriole means hydrostatic pressure will be less, so automatically it will be. And it is not constricted, but efferent is constricted. Blood is not able to coming out, so it will be blocked here, so GFR will be increased. Initially it will be increased, thereafter finally it will fall. Bowman constriction of afferent arteriole, constriction of efferent arteriole, initially increase, finally decrease. Systemic arterial pressure increase, because it will also increase the hydrostatic pressure. Surface area, surface area directly proportional, and permeability capillary directly proportional. Contraction of the glomerular messenger cell surface area will be reduced, so there will be decrease in GFR, and hormone and other factors, see what is their role. So one hormone is angiotensin 2, it will decrease the GFR. Another hormone is ANP, it will increase the GFR, and these are the other hormones and their effect. Okay.